Good to have Giovanna Dicandia here, who's going to speak on the topic of greener plates and healthy futures and how nurses are a big part of leading the dietary shift. So Giovanna, or Gio, is the nursing lead at Plant-Based Health Professionals UK, and she began her nursing career in Italy and joined the NHS in 2014 and has been specialising in cardiology and heart failure. She joined the Florence Nightingale Foundation Green Healthcare Leadership Programme in 2023 and founded a plant-based community at her NHS hospital. And she also completed a plant-based nutrition course at the University of Winchester in 2024 and is also a certified lifestyle medicine professional. So it's an honor to have you here, Gio.
Thank you. It's an honor for me. Thank you so much. Shall I share my slides?
Yes, please. That'd be good.
Okay.
And Gio has also really kindly shared that she will share the presentation with us afterwards. So, yeah.
Okay. Can you all see the slides?
Yes, that's good. Thank you.
Yeah. And okay, there are a few slides. I'll try to be like, we have a few minutes for questions, so I'll try to be on time, but please let me know if I'm taking too long. There is few things to talk about today. So, but anyway, thank you so much for the lovely presentation, and thank you so much for having me today. And as Anne said, my name is Giovanna and I'm a nurse, and today we will discuss about how we can advocate for plant-based diet in hospital settings. And I try to cover a few important aspects, which are sustainability, ethics, and evidence-based practice. I think Anne has already described everything about me. I've been a nurse now for 15 years. I'm the plant-based health professional nurse lead, and I have obtained plant-based nutrition certification at University of Winchester last year, and also lifestyle medicine diploma. Thanks to Plant-Based Health Professional UK, that is an organization that promotes education about around plant-rich nutrition for optimal health for both the public and the planet. And then as Anne said, I applied for the Florence Nightingale Foundation Green Leadership Program in 2023, and that's where kind of everything started for me, and I started working on a sustainability quality improvement project, which we'll talk about later in details. And I'm a member of the Nurses and Midwives National Sustainability Network at NHS England, which is a great network where you find lots of like-minded colleagues, learning more all things about related to sustainability in healthcare specifically. And I have adopted a vegan lifestyle since 2020. So what we'll talk about today is about some definition of veganism and plant-based diet, because I've noticed there is a little bit of confusion at times. So hopefully today will help with that. And then we'll touch on aspect of importance of plant-based diet on sustainability, the health benefits, of course, the ethical aspect, and then we'll see what we can do as nurses and what are the practical tips that I have found useful in my experience. So starting with some definition, what is veganism? Veganism is a philosophy, is a way of living, and it aims to exclude as far as possible all form of exploitations and cruelty to animals for food, clothing, and any other purposes. So this is the definition by the Vegan Society. So veganism goes beyond diet. So it's an ethical and environmental stance, and is rooted in compassion, justice, and non-harm. So it cannot be reduced to a diet. So there is a vegan diet, but it cannot be described just as a diet. And veganism comes also under the international human rights, and vegans in the UK are protected under the Equality Act 2010. And this means that even in hospitals, there is an obligation to avoid any discrimination on the grounds of veganism. And when it comes to patient and eating in hospital settings, this means that hospital must ensure patients have access to vegan meals. This is a useful fact sheet from the Plant-Based Health Professional website if you want to read more about this. So we look at what is veganism. Now, let's look at what is a plant-based diet. Now, plant-based diet is a whole food plant-based diet. It's a diet of vegetables, whole grains, legumes, fruits, nuts, seeds, with few or no animal products and ultra-processed food. So it can be entirely vegan or predominantly plant-based. Scientific evidence is compelling, and we know that plant-based diet is recognized by national and international guidelines and major dietetic associations like the BDA, and this is recognized to be safe and appropriate for all stages of life. Can you see still my slides? Yeah? Oh, okay.
Yeah.
Thank you. And the other good thing about plant-based meals is that this can cater for all religions and cultures, and it promotes inclusivity and unity even in healthcare environments. So every hospital should also have an equality and diversity and inclusion strategy available on the public website outlining the commitment to Equality Act 2010. And now we look at the sustainability aspect of plant-based meals and plant-based diet. So this definition, I'm sure you come across this already. This is one of my favorite definitions. It was published in 1987 and in a report called Our Common Future by the United Nations. And it says sustainable development is the development that meets the needs of the present without compromising the ability of future generations to meet their own needs. And the report was a response at the time to the growing global concern about environmental degradation. And there was a discussion about the fact that social, environmental, and economic issues are interconnected, and these cannot be addressed in isolation. And now, as healthcare professional and as NHS institution, we know well that the NHS has declared a climate emergency in 2020, and it has committed to become the world's first net zero health system, cutting carbon emission by 2045. And so these are all the emission produced directly by NHS operation and indirectly. The direct one are in the green, the indirect are in the blue arrow. And as you can see, the blue arrow is the bigger one, is in the scope 3. And that is where the NHS largest emission come from. And food is part of this. And as you can see in the other diagram, food accounts for 3% of NHS carbon footprint. Although it might look like a small number, but NHS is a large institution, and also food is something that is pretty much part of our culture. We use it every day, and we have a higher impact of food based on the usage, not just in the NHS, but worldwide. And so when we look at plant-based diet, we will see how plant predominant diet align with net zero and health promotion goals. So, sorry, apologies. Sorry, I'm just recovering from a cold, so my voice is a little bit, apologies for that. So we see how our food can impact our communities and our planet and our finance. So we know that the food system is a major driver of climate change. It is responsible for over a third of all greenhouse gas emissions, whilst being the main driver of biodiversity loss. And these negative impacts are mostly driven by animal agriculture. In the UK, 70% of greenhouse gas emission from the food system comes from the production of red meat and dairy. So what we eat really matters. It's really important. And if we do progressively remove animal food from diet, we reduce the environmental impact of our diet, as you can see. And the greatest gain comes from a fully plant-based diet, which has only a quarter of the impact on all environmental metrics compared to the typical omnivorous diet. And similarly with cow milk, any plant-based alternative is better for planetary health outcomes, really. And it's so important that we can already see the effect even in the UK and globally. Our warming planet means that we are seeing more heat waves, wildfire, droughts, and flooding with 40-degree heat waves. And that is what is happening at the current level of 1.4 degrees Celsius of warming. And at the moment, we are heading to 2 degrees Celsius by 2050. So possibly an inhabitable planet by then, which is not too far away. And even if we eliminate fossil fuel use today, the food system, if we leave it unchanged as it is, will prevent us meeting our climate goal. So we will still reach the 2-degree target by 2050. And this is, of course, also a health crisis, and that it has a cost. So we talk about sustainability aspect and the importance also plant-based to cut on cost. One of the costs comes from unhealthy diets. So in our job, we see lots of people coming to hospital, and majority of non-communicable disease like high blood pressure, diabetes could be preventable with a transition to a plant-based, plant-rich diet. And diets that are at the moment too high in ultra-processed food and lacking in fiber are costing £268 billion in direct and indirect healthcare cost. And so the World Health Organization has reported that up to 80% of heart disease, stroke, and type 2 diabetes could be prevented through diet and lifestyle. But why are we talking about food? I always think back a few years before the pandemic. I never thought about the importance of food in my career and as a nurse. There are now numerous reasons why healthcare professionals, of course, including nurses, should be concerned about the food system. So you see, there are this I'm going to talk about are just few of the negative impact of our current food system. So we have seen the health crisis and the climate breakdown, which also is cause for biodiversity loss. But we also have antibiotic resistance. 70% of antibiotics globally are used in farming. So to truly impact antibiotic resistance infection, we need to transition away from farming animals. And then, of course, we've seen the pandemic risk because of the increased risk of generates new infection disease. And these are all also tied and a consequence of animal exploitation. And then also farming is a major cause for air pollution. And this comes from the use of nitrogen, fertilizer, but also from nitrous oxide produced from the animal waste. And in the UK, a third of air pollution in our major cities comes from the food system, the majority from animal agriculture again. And animal agriculture is also a huge polluter for our water, our rivers, and our soil, our land. So, and then despite producing sufficient food globally to feed almost 10 billion people and 80 billion animals a year, nearly 1 billion people remain hungry. And in the UK, food security is declining, with even more people are unable to access healthy and nutritious diet. And unfortunately, that includes nurses and healthcare professionals. And of course, people that are that come from lower socioeconomic groups. And so obviously we see these inequalities that they derive from unhealthy diet. And so plant-based diet now, from a nutritional perspective, how this can help. Now, these are low in energy, but yet high in nutrients, so support a healthy body weight. We know obesity is another leading cause for comorbidities and mortality. And we have also evidence that a plant-based diet is low in saturated fat, and so improves blood lipids, is high in fibers, so helps satiety, and improves gut health, insulin sensitivity, so meaning that we have more of what we should have in the meat we eat, meaning that we don't find that much fiber in the meat, for example. So plant-based diet is perfect for a optimal fiber intake. And then it's also high in phytonutrients, lowers inflammation, is low in sugar, and as we said earlier, it can support health across all ages and stages of life. And this is a summary of evidence that is available, and the evidence is growing, is huge, and shows all the positive impact, especially on the most common health condition, particularly heart disease, type 2 diabetes, fatty liver disease, and cancer. And within a few weeks ago, the Eat Lancet has also come back on the importance of plant-based diet with another report that was launched and discussed thanks to the work of 37 scientists from all disciplines from 16 countries. And they were just reviewing the evidence and giving us a number of what should look like a healthy diet. And so they said that a planetary health diet is composed of more than 87% plant-based food. So animal food are not considered essential, but if eaten should be limited to the 1 portion, for example, of red meat, 2 portions of poultry, 2 eggs, 2 portions of fish, and 200 grams of dairy a day. And this is the total amount in a week. And this is estimated to save 15 million diet-related deaths per year, and mainly again from cardiovascular disease, type 2 diabetes, and cancer, and a reduction of 42% in antibiotic use. So we look at the sustainability aspect, we look at the health aspect, the importance of plant-based diet in for individual health and public health. And we must not forget about the animals. So each year, as I said, we are able to grow enough food to feed 10 billions almost of population and 80 billions land animals, and 3 trillion fishes that are killed for food every year. And by the end of this talk, so roughly 45 minutes, we will have roughly almost 7 million chickens that have been killed for food. So these are huge, huge numbers. And I think as nurses, we know compassion is one of the values we have, and I believe this compassion should not stop at human care. And so when we look at the values, at the end of the day, the reason why we care and we do what we do as nurses is because we all have values, and these are central to the nursing profession, and specifically, you all know, I'm sure, the 6 C's of nursing, which were recalled and set out by the NHS 2021 Compassion in Practice strategy. And these are care for patient, compassion, using empathy and kindness, competence, applying knowledge, and communication, being clear and respectful, having courage and to do what is right, and having commitment to patients and society. And so I have adopted this to veganism. And so I think care should be extended to all sentient being, and compassion, it means not providing unnecessary harm, which is the same concept we use with patients. We should be competent and use evidence-based nutrition, and we have, as I said, huge evidence that plant-based diet, even supported by the Eat Lancet, again this year as the best diet for individual and planetary health. Communication, we should then advocate and raise awareness about it, and have the courage to challenge norms and have a commitment to planetary and public health. And so basically, what is my idea of holistic care is about speaking up, not just for humans, but for animals and of course for the planet. And we know, we already talk about this when we are discussing about the importance of nurses' values. And nurses are important because, as our previous chief nursing officers lay out, we have 7 points of action in the new era of modern nursing. And the first one is protecting our planet. So again, in the modern era of nursing, there is an emphasis on sustainability, lower carbon care, and advocacy for those most affected by climate change. But this is nothing new. It's not something that, we've just been reviewing the last year or maybe from the pandemic. Florence Nightingale had a huge focus on the importance of environment, and she understood the importance of, for example, ventilation and light back in 1959. But today, nurses, we are also collaborating with other health professionals to create national and international policy. And this is a testament to the fact that nursing has always been about the environment as well. And you also know, I'm sure, we are very in a very privileged position, because nurses have scored very high in public trust. So this is some statistic from the last 9 years. This is the last one in 2024, where nurses are the most trusted profession. We are also the largest workforce in healthcare. So of course, this again is a good position to be in. It's a privileged position, but it gives us a lot of responsibilities and to guide behavior change in a compassionate way. And so how this can happen is, in my experience, I had inspiration for what I was seeing in America. And this is how in New York, hospitals have been leading by example. So they have been championing within healthcare, and especially 11 hospitals to start with, plant-based meals as the primary meal option, with today with excellent results, so far excellent results. So this is now been rolled out to 400 hospitals in the US, and they have had a good satisfaction rate from patients, 90%, so it's really high. They have saved money in the process, and obviously carbon emission, because we know the impact of animal agriculture on the environment. Carbon emission have fallen by 36%. This was at the beginning in 2021, if I'm not mistaken. And now most likely this is obviously increase the carbon calculation. And so, having known, after learning all this, back in 2023, I started thinking about how can I put this idea into practice. I can see this is already happening in hospital in America. Why cannot happen in the UK? So as you can see on the left, you can see, sorry, my poster is obviously, you cannot read what is inside, but that I just want to share my first experience involved with the sustainability quality improvement project that was focused on helping hospital transition towards a plant-based diet. So what I did, I started conversation across the organization. I talked to chief executives, colleagues from the catering manager, the finance team, and also the health equality directors. And of course, I spoke with patients too. I have distributed more than 100 questionnaires, and around 65% of patients and staff did express support for the transition to plant-based food, mainly for health and environmental reasons. And so finally, next month, we'll be introducing more plant-based options in our staff restaurant, And this is with the support of Greener by Default, which is the same no-profit organization that has helped implementing similar changes in New York. And at the same time, back in 2023, plant-based health professionals have brought this initiative to the UK, and they have launched the Plant First Healthcare Initiative. And as I said, Greener by Default was the organization also involved in New York, and now is working with NHS Trust for free to normalize plant-based meals as the default option. So if your hospital wants to adopt this approach, the website is highlighted at the bottom of the slides. And we have already heard some good example of good practice from some hospital in the UK, and hopefully from mine soon. I will be back hopefully with more good news. And what the Plant First healthcare team analyzed was also the inpatient menus from 36 hospitals across the UK. And they also create like a novel scoring system to assess the commitment to plant-based meals and whether high carbon foods such as red meat had been removed or limited on menus. And they analyzed also the use of behavioral nudges based on menus presentation. So, for example, using plant-based plant-based meals on top of the menus, for example, or having them suggested by the catering staff or the nursing staff. But all this does not come without barriers. So I think I can spend a lot of time on this slide, but I will say that the main limitation I have encountered, obviously, plant-based nutrition is not part of the education at nursing university, and not even in medical education. Things are gradually and slowly changing. But obviously, when you come to, for example, talking to dietitian, you think that there might be more like up to update evidence in nutrition. But even dietitian in a recent study, they didn't feel supported and educated enough because of the university curricula to talk about plant-based diet. And then, of course, we have also cultural and practical challenges because we are talking about a behavioral change. This is not something that we just ask a supplier to give us more plant-based food. We have also to educate the public. And this is something that is very much linked. I mean, food is very much linked to our culture, our way of being and being in a community, enjoying life. So it can be complex, it can become complex. And then, of course, time constraints. And again, here I could spend, I don't think there's much comment here. I mean, working in NHS as a nurse and as a healthcare professional, I think time constraint is one of the main barriers for possibly every project you would like to do in your workplace. And then, of course, NHS has other priorities. So, for example, we talk about the pandemic, the social care crisis, the escalating cost of living, reduced funding in the NHS. And so every time, if you, in my experience, when I have approached the executive team, for example, the main issue was about costs. And so I had to make a compelling case about the fact that plant-based diets can save costs in the long term, in the short, but mainly in the long term. And then we have also seen there's been some articles recently about the lobbying and influence from the Eat Lancet report, the Oxford study, and where basically we've seen that meat and dairy industry have used billions for pushbacks and for like denial of climate change. And then if you look at the NHS 10 years plan, for example, food is not mentioned. I mean, sustainable food is not mentioned at all. Plant-based not even a sentence about it. The only time that the food is mentioned in the report is when there is a goal to limit junk food for children, and that's it. But where there are barriers, we should see opportunities. So I think this is how I think I can see it, and because it can get sometimes overwhelming with everything going on in the world, especially with climate change, and whereas like you might feel like a sense of despair, sometimes action is the best thing to kind of overcome the despair. And first and foremost, education is our most powerful tool, and in this case in plant-based nutrition. Be a role model and stepping out of our comfort zone. I am an example of that because I've never... Hello? Can you hear me? Okay. Oh, sorry, I thought there was a question. They said, is there a question? No, okay, sorry. So, and I was saying stepping out of the comfort zone because this is obviously very important. It's part of what we are as nurses and what we do. And starting conversation around plant-based diet at home, at work, and always with a positive tone, because this is not about limiting people's choice. It's not about removing meat. It's about the abundance, the variety, and the benefits of plant-based diet. And then, of course, try to normalize plant-based meals in hospital, sharing success stories, as for example we've seen in America, and hopefully more in the UK, and normalize plant-based food nutrition as safe and beneficial, especially in healthcare settings. And then also other things, organize talk at your workplace. Look for support and allies. These are very important. So try to create a community. And as Anne has mentioned earlier, I have founded a community at my local hospital. So we have a WhatsApp group. It's a small group, but it's a good start. And you never know, that little impact can one day bring bigger changes in the hospital. And in fact, in my experience, after a year, this has become to take shape with the pilot. And then engage with the catering team, try to influence nutrition and hydration policy, of course, in collaboration with the dietitian team. As I said, approach the executive team at the hospital. But I guess eventually is the catering and the estate and facility team might be the best person to discuss changes, because of course we are talking about the food provision at the hospital. And then, yeah, we've seen how food is a major contribution of climate change, the way our food system is today. And still, food is not much discussed when we talk about sustainability. So we need to bring more the importance and the evidence around plant-based food into sustainability. And also collaborating and seeking the support of NHS England. We have seen some differences across the country. I have noticed this because I've noticed there are more hospitals that are well equipped. They have like sustainability clinical lead, which are also nurses, and other hospitals, they don't have any sustainability clinical lead. And it can become quite difficult to approach this discussion in your workplace if you don't know where to start, and especially if there is no support. So we are now collaborating with NHS England to try to bring to raise awareness about plant-based food. And finally, it can be done. So I know it sounds a lot, but as nurses, we all do this, and we can do even more. Talking about community, obviously you can see the first picture is where last year it was at the Plant-Based Health Professional Nutrition and Lifestyle Medicine Conference, and here I am with some of the inspirational nurses I have met and I had the privilege to work with since. And then as nurses, of course, work as healthcare professional, we are passionate about sustainability, but it's not just about food. And I promise I don't talk just about food. So for example, you can see in the picture in the right top corner, I celebrated this year 10 years of cycling to commute, and I've taken the opportunity to celebrate also the a project that I've supported and I shaped with the cardiac rehabilitation team. So we are now signposting patients to cycling sessions after they have had cardiac events like heart attack, bypass surgery, or valve surgery. And this is also to promote obviously health, but also sustainability, and with the hope of trying to educate to use like different method of transportation that are more sustainable for the environment. And at the bottom, this is how everything started when I was in 2023 at the Eden Garden with the Florence Nightingale Foundation nurses for the Green Leadership Program. And everything goes around the importance of how even nurses, even if we are busy, we can still make an impact. And I would like to conclude with the 7 points from my colleagues and friends at Real Zero, which are things that also as nurses we can do and we can advocate for. And I will leave it for you to read. And I can also share some resources from plant-based health professionals. So there are textbooks, there is a podcast called In a Nutshell, the plant-based nutrition course. There is also a documentary I would recommend. It's called I Could Never Go Vegan, and a 21-day plant-based challenge. And going forward, these are my contact details. So what I'm trying to do now, I'm trying to work on a nurse's toolkit. So about how to bring changes in healthcare setting, specifically regarding plant-based diet. So if you would like to collaborate, if you are a nurse and would like to collaborate, please get in touch. And thank you so much.
Well, thank you so much, Giovanna. That was really inspirational, and yeah, it was such a great talk. Just opening the floor for any questions.
Oh, hello, Lucy. Hi.
Hello, I know you made me smile lots. You made me smile an awful lot. It's nice to see your cohort on the photo. Giovanna, you've achieved so much since when I first met you back at the Eden Project. What motivates you and what keeps you going?
Yeah, as I said, it can get quite overwhelming, and to me it seems quite like a lack of awareness. And so as nurses we should be upfront in terms of education, and so educating the public is, I mean, something I'm passionate about. I mean, I find out at least in the last few years, but then also it feels like we are wasting our energies during doing what we do every day, like in terms of working and going to work every day and looking like at these patients coming in and out of hospital without understanding what is the root cause. And so when you are such amount of evidence and you come across them and you see why this is not happening, why there is not much talk about. So that's what I think is still making me, doing talks and things that I've never done before, but I'm very happy to, because I think it's very important we talk about these things and sustainability in healthcare. And you know better than me, we are surrounded by so many inspirational nurses, and sometimes we work in silos and we don't know there are so many of us out there. So yeah, that's inspirational as well and keeps you going, definitely. Yes. So thank you so much as well for all you do.